Today, let us know about hypertension. Clinically significant hypertension. Diastolic pressure above 80 mmHg or systolic pressure above 120 mmHg indicates hypertension. Now, let us know what is diastolic pressure and what is systolic pressure. Measurement of pressure exerted when blood is ejected into arteries, that is, when heart beats, is called as systolic pressure, and measurement of pressure when blood exerts within arteries when the heart rests between the beats is called as diastolic pressure. Types of hypertension. There are two types, essential hypertension and secondary hypertension. Essential hypertension is otherwise called as primary hypertension. It is the most common one. Etiology is idiopathic for essential hypertension. Pathogenesis of primary hypertension. First one is genetic factors. Genetic factors play an important role in hypertension. Second one is insufficient renal sodium excretion. When there is insufficient renal sodium excretion, it sequentially leads to increase in fluid volume, increase in cardiac output, and peripheral vasoconstriction. Thereby, this increases the pressure. Third factor is environmental factors. As we know, stress, obesity, smoking, physical inactivity, and heavy salt consumption are involved in environmental factors. Fourth factor is vasoconstrictive influences. Factors that cause the vasoconstriction and stimuli that cause the structural changes in the vessel wall lead to peripheral resistance, thereby increasing the pressure. Now let us see about the secondary hypertension. Secondary hypertension is a rare one. So the factors that are present for secondary hypertension is renal factor, endocrine factor, and cardiovascular factor. Now first let us see about renal factor. Renal factor is chronic renal disease and renal artery stenosis may induce the hypertension. Now let us see the endocrine factors. Pheochromocytoma, Cushing syndrome, and Conn syndrome induce hypertension, and cardiovascular causes coarctation of aorta and polyarteriotis nodosa increases the hypertension. The vessel wall undergoes two types of morphological changes, hyaline arteriosclerosis and hyperplastic arteriosclerosis. Now let us see what is hyaline arteriosclerosis. Hyaline arteriosclerosis is seen in benign hypertension, homogeneous pink hyaline arterial thickening of the walls and luminal narrowing of the vessel walls is seen here. Whereas in hyperplastic arteriosclerosis, it is seen in severe hypertension. Concentric laminated, that is onion skin thickening of arterial walls with luminal narrowing is seen in hyperplastic arteriosclerosis. Now, the complications of the hypertension are aortic dissection, atherosclerosis, stroke, and renal failure. Thanks for watching. Do like, share, and subscribe the channel. Thank you. Now let us see about complications of hypertension. They are aortic dissection, atherosclerosis, stroke, and renal failure. Thanks for watching. Do like, share, and subscribe the channel. Thank you.